I love helping people have whiter teeth. Whiter teeth are such a gateway service because they become interested. They become better patients. They do a better job of brushing. They do a better job of flossing. They're more faithful about keeping their hygiene appointments. They become more interested in other ways they can enhance their appearance of their teeth. So you could look at developing a year-round calendar. Maybe we do a Valentine's Day special. Maybe the next time we do is we do something around Mother's Day. Maybe we do something around 4th of July. And maybe we do something in the fall. And you could offer a savings on whitening. I'm a fan of making whitening as affordable as possible. Well, you should make a profit with it, but make it affordable. And you could offer a special price. Hey, for upcoming Valentine's Day, we're doing this. And it's available during this window of time. And maybe they can even purchase, because they might not be ready to do whitening, maybe they can purchase a gift certificate where they can have whitening done, at a time that's more convenient to them. But another example of using the concept of scarcity and timing to create urgency. Naren, what's your example?
Yeah, the example I'm going to share, Gary, might be a little bit advanced, but I think our audience is ready for it. Going back to the way we defined scarcity, right? It's really the fear of missing out at a fundamental level. That's kind of in other words, when you're trying to frame something, don't talk about what they're going to gain, but talk about what they will miss if they don't do it, right? And people are much more driven by the fear of loss or not having something than they are by what they're going to gain. So that's where the whole scarcity thing comes from. So let's say you are talking to a patient who has indicated to you in your new patient interview that a beautiful smile is important and they have some major challenges, right? And you're like, oh, you're having a conversation about that situation. And then you show them, you go through your book and you show them some of the cases you've done where you transformed smiles. You created that beautiful smile. And when you're going through that, you can say, oh, by the way, the number one regret that all these people had is they didn't do it soon enough. Like this particular person did it in their 60s. They're like, I wish I had done it in my 40s. I could have enjoyed 20 more years of this amazing smile versus hiding my smile and not getting in front of patients.
They wish they would have done it sooner.
Yeah, they wish they would have done it sooner.
Little sidebar, Naren. One thing to put this, circa 2024 and beyond, great idea is to create a digital library on a tablet that has just befores and afters. Now, always make sure you get your patient to sign an authorization form allowing you to use their image for marketing and educational purposes. And even if all you're going to do is show the smile, and these could be just close-ups, that's fine. But just to protect yourself, make sure you have that model release where the patient signs that. And now you're going to show before and after, before and after, before and after. And pretty soon, if we show before and after, we show 5 or 6 or 7 of those befores and afters. What's one of the things that becomes imprinted on the patient's mind is, wow, this isn't your first rodeo. You've done this before.
Exactly.
And then you can comment, you can say, one of the most common things we hear after the patient looks, sees themselves in the mirror with their new smile is, man, I wish I would have done this sooner. So I love your example, Naren. That's a great example of, planting a seed that maybe it would be better to have this done soon.